Good afternoon, or good morning, everyone. My name is Dr. Jim Douketis, and on behalf of Thrombosis Canada, I would like to welcome you to this webinar, Blood Clots and COVID-19, Answers for Patients and Families. In the next hour, we will talk about up-to-date information relating to thrombosis and COVID-19. We'll also talk about managing thrombosis and anticoagulants or blood thinning treatment in this time of social distancing and how we are adapting to maintain the expected high level of care. Finally, we will also talk briefly about the coronavirus, which causes the disease COVID-19. Next. Before we begin, the system has automatically muted all of the phones except for the speakers who you see. If you have a question, please use the chat function to post it, and I will do my best to ensure that your questions are addressed. If we can't do it during this webinar, we will be posting questions and answers to our website. Today's program is being recorded for archiving on the Thrombosis Canada site and YouTube channel. I'd like to thank you and to thank our donors for their support, which enables us to deliver programs such as this. To get us started, I would like to introduce our faculty. I'd like to point out that this content was developed by this faculty who are experts in this field. We have Dr. Eric Tseng, who is a hematologist at St. Michael's Hospital, Toronto, and assistant professor of medicine at the University of Toronto. Dr. Stephanie Young, a pharmacist at the Eastern Health Regional Health Authority and associate professor at Memorial University. And myself, Jim Douketis, physician at St. Joseph's Healthcare, Hamilton, and professor of medicine at McMaster University. Next. This program has been created by Thrombosis Canada without any financial support. And again, I wish to remind you to use the chat function if you have any questions. A little bit about Thrombosis Canada. We are a non-profit group that is dedicated to furthering knowledge in thrombosis. And although we are targeting mostly healthcare professionals in this goal, we also have many resources for people like you, for patients, and for their families. So please visit our website to get this type of information and follow us on Twitter for updates in this emerging field. Next. So what is thrombosis? Well, first of all, it is a very common condition. It affects millions of people in Canada and at least 100,000 people each year. Here are a few famous faces that have been suffered from thrombotic disease or are receiving blood thinning therapy. You know, of course, Serena Williams, the tennis star, Chris Bosh, the basketball player, Hillary Clinton. And for some of us of an older vintage, on the left-hand side, we may recognize Jimmy Stewart, the actor. Next. We will be focusing on thrombosis as it affects the blood vessels in a manner as shown here that can cause clots. These clots, next, can form typically in the veins of the legs or in the veins of the lungs. When it occurs in the legs, it is referred to as deep vein thrombosis. And here are some of the symptoms that people with deep vein thrombosis may have. If it occurs in the lungs, it is referred to as pulmonary embolism. And here are some of the associated symptoms that occur with pulmonary embolism. Now, to help you remember these symptoms, Thrombosis Canada has developed what we call the CLOTS campaign. This highlights certain symptoms that you should be aware of, and if they occur, to seek medical attention. So the C refers to chest pain, the L refers to lightheadedness. The O refers to being out of breath, occurring with a blood clot in the lungs. The T refers to leg tenderness when the blood clot occurs in the leg. And the S refers to leg swelling. If you have or know people that have one or more of these, please make sure that they seek medical attention. Now, blood clots also occur in the arteries and, of course, can lead to stroke and to heart attacks, and we will be touching on this as well. So now a little bit about COVID-19. This is the illness that is caused by the coronavirus, and that's the long name you'll see there on the screen. And we, of course, know that it has affected millions of people worldwide and tens of thousands of people here in Canada. And, of course, this is a pandemic that has touched pretty well every person on the planet. A bit of information about risk factors for COVID-related disease and adverse outcomes that you see here, and some information on the ability of this virus to spread and the period that it is most contagious among people. And of course, we've heard a lot about how it can spread among people who do not have any symptoms whatsoever, thereby justifying some of the very difficult social distancing that we have to partake in. And at this point, I also just want to take a shout out to each and every one of you in the audience and all Canadians for their efforts, and in particular, the sacrifices you have made and others have made to help combat this pandemic. A few things about the diagnosis of COVID-19 and coronavirus. Of course, we use a variety of tests that require a sample, typically from the nose or the nasopharynx. And this test, in most cases, is very specific, meaning that it is positive. That means you are harboring the virus, but it is not 100% sensitive, which means that if the test is negative, you could still have the virus, and this depends on at what point of the infection the test is done. So we have to have a heightened sense of caution. A few of the clinical features, a lot of these overlap with typical symptoms of a viral infection, such as influenza, but there are also some associated unexpected symptoms that we are still learning more and more about. And as you see, it can affect the lungs, as shown by the x-rays on the right lower hand side. And it is similar to other infections, particularly viral infections. Next. There are a myriad of treatments that are being intensely investigated by the medical community worldwide. For now, most of these treatments are unproven and are being investigated in what are referred to RCTs, or randomized clinical trials. These type of studies are the best way we can reliably determine if a treatment will be effective and safe. For the time being, patients are also being given what we refer to as supportive care, as shown above, that may include oxygen and, in some cases, antibiotics. And you'll see among the treatments being investigated are also blood thinning treatments to see if this will help in reducing the burden of thrombosis that is associated with COVID-19 that you will hear about. Next. So now we're going to switch to the next part of our presentation, and I will now engage our panelists. And again, we will have the opportunity for you to ask questions, and hopefully we will answer them, as many as we can, during the Q&A period. So the first question that may be on your mind is, what is my risk for thrombosis if I am COVID-19 positive but have mild to moderate symptoms and I'm staying at home? And I'll ask this to Dr. Young. Stephanie.
Thanks very much. So, although having an infection with COVID-19 may increase your risk of developing a blood clot, this is primarily for patients who end up being hospitalized. And those are often patients who are much sicker. So the risk for patients who are COVID-19 positive and who are at home, so the risk of thrombosis is likely low, not really much different than if a patient had a different viral illness such as the flu.
Jim, you're muted.
And a related question may be, if I have COVID-19 and have mild or moderate symptoms and I am home, should I be receiving a blood thinner such as a heparin injection or aspirin? What do you think, Stephanie?
So again, in general, patients with COVID-19 who are at home don't need to receive blood thinners such as heparin type injections or aspirin, because such treatments are associated with an increased risk of bleeding, especially in elderly patients. So this is something that would really need to be thoroughly discussed with your doctor.
Okay, let's move on now to another question. And here is a situation where it would involve a patient that has had a prior thrombosis, either a deep vein thrombosis or pulmonary embolism, but they are no longer receiving blood thinning treatment. Sometimes it's given for 3 months or 6 months. And the question is, well, if I become infected with the coronavirus, COVID-19, should I restart the blood thinning treatment? And I'll put this over to Dr. Eric Tseng. Eric, what do you think?
Thanks, Jim. So this is a really important question, and it's a very common question that we get nowadays. The short answer to this, and then I'll expand with that, would be that in most cases, as Stephanie had mentioned, if you become infected with coronavirus, but you have mild symptoms and you're an outpatient, even if you have had a history of thrombosis previously, if you're not on blood thinning medication at the moment, we would not routinely recommend that you be restarted on your blood thinning medication if you're not on them already. A couple caveats to keep in mind. So this is with the assumption that you are an outpatient, not admitted to hospital, and that you have reasonable mobility. And we should also keep in mind that in general, if you have had a clot in the veins or a heart attack or a stroke, there is some risk of the clot coming back in general if you're off of blood thinning medication. The other thing to keep in mind is that there are things that we can do besides taking blood thinning medication that can reduce the risk of thrombosis coming back. And in particular, these would be things that we can engage in with our daily lifestyle. So for example, if you do have mild COVID-19 infection, I would encourage you to not stay in bed and at least get up out of bed and try to go for a walk socially distanced 3 or 4 times a day. And we'll talk a lot about this later on, but if you do have symptoms or signs of the clot coming back, then you should certainly seek medical attention. But in general, I think this is a case-by-case situation, but in general, we would not recommend that you resume your blood thinner.
Thank you, Eric. Next question relates to people who may have what we refer to as a prothrombotic blood abnormality or a bit of an imbalance in the blood that may predispose a person to develop blood clots. So these predispositions include what I refer to as the factor V Leiden mutation, prothrombin gene mutation, and there are other conditions. I think one of our audience members brought up antiphospholipid antibodies, or APLA. So in a person that has one of these sort of blood imbalances, if we can call it that, Eric, but they've never had a blood clot per se. And if they become exposed to or infected with coronavirus, should they be starting blood thinner or aspirin?
Thanks, Jim. So again, I'll start with the short answer and then expand on this a bit. The short answer would be that we would not routinely recommend that you start a preventative blood thinner or aspirin. And I wanted to talk a little bit about this because this is also an important and common question. So factor V Leiden and prothrombin gene mutation are genetic abnormalities that may increase the risk of a first episode of a vein blood clot. It's important to keep in mind why we test for these and how we find out about these abnormalities. We do test for this blood abnormality occasionally in people who have had thrombosis previously or in patients where there is a family history of thrombosis. The other thing I wanted to mention is that some of you may have had some of these commercially available genetic screening panels done to screen for a wide variety of genetic changes, not just related to thrombosis, but for other diseases as well. And you end up with this report showing that you may have one of these mutations without ever having had a deep vein thrombosis or pulmonary embolism in the past. So again, we're talking about patients or people who have never had a blood clot before, who are asymptomatic, who have one of these genetic abnormalities. In these situations, if you've never had a blood clot before and you have factor V Leiden or the prothrombin gene mutation, the risk of thrombosis is still very low. And in most cases, it is not recommended that you start with a preventative blood thinner or aspirin because there is a bleeding risk associated with this, and we do not have good evidence that there is benefit in these low-risk situations. The other thing I wanted to keep in mind is that there are genetic conditions or inherited conditions that are higher risk for thrombosis, higher risk than factor V Leiden and the prothrombin gene mutation, for example. These are conditions where the decision-making may be a bit more nuanced. And in these specific situations, you should speak specifically with your hematologist or healthcare provider about what to do in those more higher risk situations. I can also address the question that Jim had mentioned before. There was a question about someone who had antiphospholipid antibody syndrome and was already on warfarin therapy, for example, and whether they were at increased risk of having another thrombotic event while on warfarin. At the moment, we would suggest that you continue taking your blood thinner as directed by your physician. Dr. Young will speak a bit later on about strategies for improving social distancing in patients who are on Coumadin, because that's certainly a challenge. But in general, to answer this question, we would not routinely recommend a preventative blood thinner in these lower risk hereditary clotting conditions.
Thank you very much, Eric. Let's move on now to some issues that pertain to people who are in long-term care or retirement facilities. Of course, this has been in the news quite a lot recently. So the next question would be, I have a family member who's living in a retirement home, and one of the residents in that facility has tested positive for COVID-19. And of course, this is a very potentially frightening situation. And the question is, should my family member who is otherwise well, and at this time we don't know that he or she has COVID-19, should they receive a preventative or blood thinner or aspirin to protect against thrombosis? Dr. Young, what do you think about this situation?
Thanks very much. So if we look at patients in a retirement home as being, otherwise well and, self-sufficient and essentially able to look after themselves, we wouldn't consider them any different than patients who are at home that we've already talked about. So these patients wouldn't need to receive a blood thinner or aspirin in general.
Okay, and let's go now to a nursing home situation, and I'll sort of tackle this scenario. nursing homes are, of course, very different than retirement homes, and they're quite varied in terms of the level of care that is involved. And we know that in a nursing home, many, if not most people who are residents have additional risk factors for developing blood clots. They may have concurrent illnesses. They may not be able to get out of bed very much. And all these things predispose to blood clotting. So here, the situation is that we would more consider the use of a blood thinner as a preventative agent against blood clots, irrespective of whether that individual has tested positive for coronavirus. So I think the needle is moved more towards advocating for preventive interventions such as use of blood thinners. Now, of course, this is not something for everyone. It has to be aligned for that individual nursing home patient's goals of care. And this is a discussion that should be taken on by the patient, the family, and the physician. But this is a situation that in general warrants more discussion and in most cases consideration of a blood thinning treatment to prevent blood clots in this setting. Let's move on now from the community to the hospital setting. And here's a question relating to a family member who is in hospital with COVID-19 infection and is unwell. Is he or she at increased risk for developing blood clots? Should he or she be receiving blood thinners to prevent such blood clots from occurring? Stephanie, you work in a hospital setting. What do you think if you were asked this question?
So the first question with regard to the increased risk of developing blood clots. So patients with COVID-19 who are hospitalized tend to be sicker and need additional therapy such as oxygen and supportive therapy, as we've already mentioned. So in these people, the risk of blood clots is considered higher because certainly of the hospitalization, but as well because it appears from what we know that the COVID-19 infection causes changes in the blood that can lead to blood clot formation. So to answer the second question, so for all of these reasons, it's really advised that patients who are hospitalized with COVID-19 infection receive blood thinners such as the heparin type injections that are given under the skin once or twice a day to prevent blood clots. So the healthcare team will decide, what blood thinner is the most appropriate and what the appropriate dose is based on the characteristics of the patient as well as what the local hospital protocol may be. Because most hospitals will already have some type of protocol to look at this issue. And certainly there may be occasionally patients who aren't able to be given the blood thinner medications. So there's other devices or measures that can be used, such as special leg stockings or compression devices that help to increase the blood flow.
Thank you, Stephanie. And I just want to stress how prevention of blood clots in hospitalized individuals with COVID-19 is really of paramount importance. And this is the area which is under intense scientific and medical investigation. A lot of the studies are being done in these patients because these patients are at highest risk for thrombosis. So doctors around the world are looking at different ways, different blood thinners, different intensities of blood thinners to help reduce the burden of disease associated with blood clots in patients with COVID-19 who are in the hospital. Now, happily, many people recover from COVID-19 if they are in the hospital, and if they now are going home, and the situation is about should they be receiving blood thinning treatment. So if we go to the next slide, a person was hospitalized for COVID-19 and they did require care in a ICU or other critical care setting. They have now recovered and are at home. They received blood thinning injections while they were in the hospital. And Stephanie, I'm going to ask you, should they also be receiving these blood thinners when they are at home? And if so, for how long do you think they should be getting them?
So for the patients, I'll just mention who didn't need care in the ICU. The majority of those patients with COVID-19 won't routinely go home on blood thinning injections unless they haven't quite fully recovered or are at continued risk. So patients who require intensive care unit visit, so these are only really a minority of patients who have COVID-19, about 5% that have the more serious life-threatening infection and need ICU care. And those are the patients that are considered at very high risk. And obviously you want to try and prevent blood clots in these patient groups. And as Jim mentioned, in some cases, you know, what the appropriate dose is certainly an intense question of research and investigation. But once patients have recovered enough to go home, really the healthcare team will look at whether or not they still are at risk. And some of the sickest patients who recover may very well be at increased risk. So they may benefit from continuing the blood thinner when they go home. And generally it's for several weeks, up to about 4 weeks after discharge from hospital. And again, the healthcare team will decide, you know, what the best medication is, as well as the appropriate dose.
So it certainly is a consideration for all patients, but all people will not need it. It's something that, again, should be discussed with the healthcare team at the time of discharge from hospital. Let's shift gears a little bit and talk about young people. And once again, you may have heard in the news about this condition associated with dusky colored toes, and whether, if it occurs in children, if this means that they have coronavirus or COVID-19. So I'll sort of try to address this question. First of all, we know that the coronavirus cases that have affected people, only 1 or 2% of them occur in younger people aged 18 or younger. Secondly, this condition of the dusky colored toes has been observed as a very rare occurrence in the United States, in Italy, but not in Canada. Thirdly, we don't really know what this means, and we don't know whether this in fact is related to the coronavirus. There are other viral illnesses that can affect the blood vessels, causing inflammation, causes other symptoms, typically fever, a rash, enlarged lymph glands, and may be responsible for this manifestation, if you will, of these dusky colored toes that, once again, is very rare, but is something that the medical community is keeping a very close eye on. So what does this mean for us here in Canada? Well, of course, if anybody, young or old, develops coloration changes in their toes, especially if it's persistent, then they require medical attention. But at this time, this is something that may or may not be linked to coronavirus and is quite rare. So we're going to move on now from our children to our pregnant population. And here's a question for you, Eric, involving potentially a pregnant woman who has coronavirus, but is otherwise well and may have very mild symptoms. Should a person like this be receiving blood thinners during their pregnancy? And what about after their delivery? And again, recognizing that for those people out there who are pregnant or planning to have a child, it's a very stressful circumstance at best. And should they be concerned about thrombosis? What do you think, Eric?
Thanks, Jim. So as Jim mentioned, this is a challenging time to be pregnant, go through prenatal care, and come into the hospital for delivery. The situation we're talking about is a routine pregnancy in someone with a mild COVID-19 infection, but otherwise well with no previous history of clotting. If you are pregnant and you do develop a mild COVID-19 infections, in most cases, the risk of blood clotting remains low, and blood thinning medication will not be recommended before delivery or after delivery. A couple caveats to that statement. The first would be that if you do have a previous history of thrombosis, then your risk would be higher than other people if you do develop COVID-19. And certainly you'd want to speak with your doctors about whether providing blood thinners before delivery would be advisable. And then certainly after delivery, when the risk of thrombosis is highest in the first 6 weeks postpartum, you'd want to have that discussion with them as well if you do develop COVID-19 infection. The second sort of caveat to that statement is at the time of delivery, when pregnant women are admitted to hospital for a routine vaginal delivery or C-section, the medical team may discuss with you about receiving preventative blood thinners while you're in hospital after delivery, but not after you're discharged if you do have COVID-19 infection. So that's something to keep in mind, and that's something that may be discussed with you while you're admitted for that brief period for your delivery. The other thing to keep in mind is, most of the time, vaginal delivery, C-section is routine. Occasionally, there are issues that can happen during delivery or afterwards that can also affect your risk of clotting as well. And so that's something you should speak with your healthcare providers about too.
Thank you, Eric. Let's go to the next question, and this looks at things in from a different perspective. It pertains to the person who has had a history of blood clotting, whether it's deep vein thrombosis, pulmonary embolism, or even clots in the arteries, like a heart attack or a stroke. Eric, are these individuals at higher risk of developing coronavirus and COVID-19 infection?
So the answer to this question would be, as far as we know, no. So if you have had a previous deep vein thrombosis, pulmonary embolism, heart attack, or stroke, we don't think your risk of developing or contracting the COVID-19 infection is higher than another individual. That being said, if you have had one of these conditions, sometimes if you have had one of these conditions, it can carry company with other medical comorbidities. And if you are someone who has had blood clots and other medical illnesses, that might put you at risk of developing a more severe infection if you do contract it. But but that's a general statement, and in general, we don't think of the history of a blood clot increasing your risk of developing the infection in general.
Okay, well, what about COVID-19 infection and blood clots in the arteries? We focused much of our attention today on blood clots in the veins, but in somebody who has COVID-19 infection, are they at risk of developing blood clots in the arteries, such as a heart attack or a stroke? So I'll address this briefly. We do know that there are some reports of people with the coronavirus who have developed blood clots in the arteries that can cause a heart attack or a stroke, but these episodes appear to be infrequent. And of course, there are many factors that can lead to the development of a heart attack or a stroke that are completely unrelated to COVID-19 infection. I think what we would advise people, and what we're seeing as healthcare professionals, is that there may be a reticence for people that may have chest pain or pressure that could indicate a heart attack, or may have weakness or numbness that may indicate a stroke, and their reticence to visit a healthcare facility. And we would certainly urge people to not delay medical attention because of these symptoms, to visit a facility and receive appropriate and timely treatment. We'll chat a little bit more about that later. So let's go on now to the next section. We've talked so far about coronavirus and COVID-19 illness and the risk for developing blood clots. And we've emphasized how the main risk is among people who are in a hospital setting or perhaps a nursing home setting, and that in the vast majority of people who may have COVID-19 but have mild symptoms, their risk is generally low of developing blood clots, especially if they are cared for at home. But now let's switch to those people who are currently managing blood clotting conditions and are receiving blood thinning therapy, and how to do this in this period of social distancing where we're not seeing our doctors or healthcare professionals face to face. It's by telehealth, or we may not be able to go for as frequent blood tests. So Stephanie, you deal a lot with these patients, and here's an example of a person who may be receiving warfarin, a commonly and widely used drug to prevent blood clots for an irregular heartbeat, and in some cases for other patients who have mechanical heart valves or blood clots in their legs or lungs. And they typically would have blood testing or the INR test every 2 to 4 weeks. And they may be concerned about visiting a laboratory for blood testing. So can they go to a laboratory facility less often for blood tests in a safe manner? Are there alternative blood thinners that they can use instead of warfarin that does not require blood testing? And finally, is there a way that they can check their blood thinning with a device at home? So a few questions for you, Stephanie. What do you think?
Thanks very much. So, certainly this was a question that our service got right from the get-go of the pandemic. And I guess, first of all, I'd say to patients who are on warfarin that the hospitals and the labs have processes and procedures in place to ensure your safety when they have to do blood work. So certainly, I'd encourage people to still go and get their blood work done and get their INR measured. In terms of going less often if you're on warfarin, this is always certainly a question we get asked, is that for patients whose INRs have been kind of consistently within the recommended therapeutic range for at least several months, you can spread out, there is evidence to say you can spread out the frequency of the INR testing to every 8 weeks, and even in some cases out to 12 weeks. So this is certainly something to discuss with the healthcare practitioner that's looking after managing your warfarin. However, what I would say as well is that if you do make the decision with your healthcare provider to do this, make sure that if anything changes, so any changes with your health or with your medication, that you let them know, because that may mean that you need a test done sooner. So we certainly have information to go less often in patients who are stable. In terms of another blood thinner, for many patients, but not for all patients, unfortunately, there are other blood thinners called direct oral anticoagulants, or we call them DOACs, that you can take instead of warfarin, that don't require the same frequency of blood work or the same regular blood work as we do with warfarin. And certainly we know that they're as safe, and in some cases safer than warfarin, but they're more expensive. So what I would suggest is, if this is something that is of interest or concern, is that you chat with your doctor to see if you would be eligible for one of these medications. So a question that comes up sometimes is with regard to checking patients' INRs with a device at home. So there is a handheld device that you can use to check your INR, basically done with a finger stick, very similar to if you were having a test done to check your blood sugar. So there's certainly the devices that are available. Patients who are considering this do need some education about how to appropriately do the test, how to appropriately maintain the machine, and as well what to do with the, or how to use the information to manage their warfarin therapy. The challenge is that these devices cost several $100s, and the strips that you would need do cost about $8 to $10 per strip. And as of now, they aren't covered by any of the provincial healthcare plans or many of the private healthcare plans. But certainly, if it's something that is of interest to you, then, speak to either your doctor or whoever's looking after your warfarin, or even your pharmacist as well, because they may have more information about the devices.
Thank you very much, Dr. Young, for that question. We're going to move on now to Dr. Tseng. And Eric, what about people who have had a blood clot in the past and they receive their, or continue to be receiving their blood thinners, and sometimes they may have additional X-ray tests to determine if the blood clot is still there? Can you comment on, is that really something that's necessary? And if so, how can we address it in this sort of social distancing time?
So the question that Jim is asking is the scenario where, let's say you've had a pulmonary embolism or a deep vein thrombosis, and then at some point, maybe 3 or 6 months down the road, while we're still in the midst of the pandemic, the question comes up about whether you should have repeat imaging to see what's happened to the blood clot. The short answer to this question is no, that we generally would not recommend repeating the X-ray or ultrasound to see if the clot in the legs or the lungs is still there. And the reason is twofold. Firstly, in most cases, the presence or the results of repeat imaging tests will not change the treatment decision about how long to continue blood thinning medication for. And the second is that it's obviously difficult to get repeat imaging and it makes social distancing challenging. And so in general, we would not recommend routinely that you have repeat imaging. To that, the first is that there may be situations when your doctor feels that repeat imaging is helpful. You should speak with your provider specifically about that after discussing the benefits and risks of doing that testing. Secondly, if you do have symptoms of a pulmonary embolism or a deep vein thrombosis that come back, you should seek medical attention. But I do want you to keep in mind, in most cases, if it's a pulmonary embolism that you had and the chest pain and shortness of breath have gotten better or resolved on blood thinning medication, if it's leg pain or swelling that's gotten better on blood thinning medication, in most situations that means that the clot has either gone or substantially reduced in size. And so that's a really important message to keep in mind. And we have to make these decisions carefully to ensure that we keep safe with social distancing.
I fully agree, Eric. A lot of times these tests are not needed even outside of this COVID-19 era. And you actually touched upon the next question, which is if there is a patient who has had a previous blood clot, let's say a pulmonary embolism in the lungs, and is no longer taking blood thinners, and let's say they've developed a bit more chest pain or some difficulty breathing, should they go to the emergency department in case this is another blood clot? What do you think?
So I'm glad you asked this question, Jim. This is a really important question. So the scenario is if you've had a pulmonary embolism previously and you've got chest pain or difficulty breathing again, do you really have to go back to the emergency room and potentially expose yourself to coronavirus or people who are suspected of having the infection? I would strongly advise you not to downplay your symptoms and assume that it's something not to worry about. These are worrisome symptoms, and you should seek medical attention, preferably urgently, including the emergency room if necessary. The problem is that, yes, this could be pulmonary embolism, but this could be something else. This could be a heart attack. This could be something else causing chest pain. And that needs to be sorted out very, very quickly. You should keep in mind, we've been dealing with the coronavirus now for months, and there are protocols in place in most emergency rooms to segregate patients who are suspected of having coronavirus infection, to ensure social distancing to the extent that we can. And there are screening protocols in place when one enters the emergency room nowadays to provide protection. And you know, the other thing that I mentioned is that there is evidence now suggesting that for some reason, with the onset of coronavirus pandemic, that we're seeing fewer heart attacks reported, both in New York City and in Italy, for example. And that suggests to me that potentially people are ignoring their symptoms, and that's a big problem, because we can't forget that chest pain and shortness of breath are things that should be taken seriously.
Right, and just to emphasize to the audience that really the hospital environment has seen a tremendous change in how it helps in the assessment and management of patients to ensure that those with COVID-19 and are properly managed, but equally important to allow people to feel safe to come to a facility, especially if they're having symptoms like chest pain that might be a heart attack, or shortness of breath that might be another blood clot. So I think there's a message there to not delay and be reticent to seek medical attention, especially when there are effective and safe treatments available. Now, Eric, I want to also just touch on the next scenario, which involves a patient who has had a previous blood clot in the leg. So if we go to our next slide, and they are also had been taking blood thinners, but no longer. And there are lots of things that can cause some discomfort or swelling in the legs. And should these individuals also seek medical attention through the emergency department in the event they think they're having another blood clot?
Thanks, Jim. So this is another common scenario that we hear about very frequently. The challenge, as Jim described, is that if you've had a deep vein thrombosis previously and the swelling comes back, there are different reasons for why that can happen. So yes, it could be another deep vein thrombosis, but this could be something called post-thrombotic syndrome, wherein the chronic effects of the blood clot on the vein can lead to swelling and edema, which is fluid accumulation without actually signaling the recurrence of a blood clot. This could be infection. There's lots of different reasons for what could be happening here. My general advice in this situation would be not to ignore your symptoms, but in this situation, it may be advisable to reach out to your primary healthcare provider first. And instead of going straight to the emergency room, unless it's very clear that the pain and swelling are out of proportion and very, very worrisome. Usually, if you can speak with the primary care provider, they will usually be able to give you advice on whether you need to be seen in person in their own clinic, or if you should go straight to the emergency room. The other thing to keep in mind, unlike pulmonary embolism, there are ways of diagnosing DVT outside hospital. For example, often there are community medical imaging laboratories where you can get vascular or Doppler ultrasound testing done to rule in or rule out DVT. And this may, although we did discuss that the emergency room is certainly a safe place to go, this may help to establish a diagnosis or rule out recurrence of DVT and allow this to be managed on an outpatient basis. As a caveat to that, the other thing I'll mention is, even though you are seeing, you may not be seen in hospital directly, there are ways of establishing diagnosis, and in some cases, as a hematologist, we do speak with our primary care providers as well and provide them advice as well. And so, I think this is a slightly different scenario than pulmonary embolism.
Thank you very much, Dr. Tseng. Well, that brings us to the end of the questions that we had devised to anticipate some of the questions patients and families would have had relating to thrombosis in this era of COVID-19. And we got quite a few questions through the chat line, and we have a few minutes to address a few of them. One question relates to the use of hormonal therapy in younger and in older women. So, for example, in a younger woman who may be taking an oral contraceptive preparation, a pill, or perhaps in an older woman who may be taking hormone replacement therapy that's typically either by a pill or a patch. Are these individuals at increased risk for developing thrombosis in this COVID period? And if they do develop coronavirus, should they be receiving a blood thinner? And maybe I can ask Eric, what do you think about this presumably very common situation? A lot of women are receiving these treatments, and are they at increased risk further, and should they be receiving any preventative intervention?
Thanks, Jim. So as you alluded to, a very common scenario, oral contraceptive pills and hormone replacement therapy are very, very commonly used. In general, I would perceive the risk of thrombosis if you do develop COVID-19 infection to still be very low. And unless you're hospitalized or develop severe infection, I don't see a reason to adjust the hormonal therapy that you're receiving. Do keep in mind that anyone who's on these medications should know about the signs and symptoms of pulmonary embolism and DVT, and certainly seek medical attention if they occur. But in general, I would not advise adjusting the therapy or adding on a preventative blood thinner in those situations.
Another question, maybe Stephanie, I can ask you, relates to people who have had blood clots in their arteries or peripheral arterial disease, and they may be receiving a low dose of a blood thinner, a direct oral anticoagulant. And the question is this sufficient? Should they be receiving additional treatment? And would they, require more attention if they have developed coronavirus infection?
That's very good question. I think in those patients, similar to what Eric had just talked about, in the absence of coronavirus, there wouldn't be a need to adjust the therapy that's already been decided. And again, these patients are not necessarily at increased risk for to get coronavirus or COVID-19. So at this point in time, I don't think we have any data that would suggest that there needs to be any alteration of therapy. I'll put it back to you guys as well to see if you have any additional thoughts.
Yeah, I would agree. I think the message that we're trying to convey is that if you're already on a blood thinning treatment, just continue it for the reason that you've been taking it in the first place. There's no need to change that. And if you're not on a blood thinning treatment and you've had thrombosis in the past, but are concerned about getting it again, once again, the fact that we're in this COVID era should not change that. We should not be taking medications without any scientific proof, and we should be using them as they have been prescribed. Another question relates to a person who's had pulmonary embolism, and they're asking whether they are more likely to develop severe symptoms from the coronavirus if they develop this infection. And that's a very good question. We do know that people who are infected with the coronavirus and have other conditions are at higher risk for complications, and that's the case if they develop any kind of viral or bacterial infection for that matter. So people who have had a blood clot are a little bit different in the sense that the blood clot often goes away, and then their lung and their heart function kind of goes back to normal, as opposed to other people who have heart failure or chronic lung disease, and they would be at higher risk. So I think the answer to the question is that not necessarily having is your risk higher just because you have had a blood clot in the lungs or in the legs. Eric, would you agree with that, or do you have anything more to add about people who have had blood clots and now they're maybe with moderate or even with more severe symptoms of coronavirus?
I would agree with your answer there. In most cases of pulmonary embolism, most of the time, not everyone, but most of the time, their heart and lung function does go back to what the previous baseline was, hopefully. And so from what we know, I wouldn't conceive of the risk of severe respiratory symptoms being any different. But again, we're learning more and more about the disease and the complications that can come from it.
And just one last question is regarding a patient in a nursing home who is COVID positive and they are isolated. Should they be receiving heparin or as a blood thinner to prevent against blood clot? And I think, as I alluded to before, certainly people who are in a hospital environment, we want them to be receiving blood thinners in general, unless there's some reason they can't because of, let's say, bleeding risk is being very high. Similarly, in a nursing home, if that individual is ill, they're not able to get out of bed, then yes, definitely a heparin to prevent a blood clot should be a strong consideration. And I think that's we've got a few other questions, but we are running out of time. And please note that we have a lot of these questions on the Thrombosis Canada website with answers to these questions for you. So if you did not have your questions answered, perhaps they will be on our website. So to conclude, on behalf of Thrombosis Canada, I would like to thank everyone for attending today's program. Thank you very much also to Drs. Stephanie Young and Dr. Eric Tseng for their engaging presentation and discussions. We would also like to thank our donors who contribute to Thrombosis Canada for their ongoing support. If you are interested in supporting what Thrombosis Canada does by donating, please visit our website, thrombosiscanada.ca, and click on the donate button. And if you're interested in reviewing this program again or know somebody who might benefit from it, please watch our site as it will be posted shortly. And finally, we would appreciate your help by completing a short evaluation following this program by going to www.thrombosiscanada.ca, blood clots and COVID-19. The link has been provided in the chat section. Your feedback is of real importance to us to know what are some of the issues that you as patients or as families are thinking about, and we want to address them. And finally, please visit our website regularly, and in particular, our patient and family section to provide some of the information that you may be needing. And once again, thank you all, and thank the speakers for your participation and attendance. I hope you all have a pleasant afternoon and day. Goodbye.